From the studios of Tucson Business RadioX, recorded in the Stewart Title corporate offices on Broadway, you are now listening to The Mark Bishop Show. And now here's your host, Mark Bishop.
And welcome to another Mark Bishop Show. In honor of National Kidney Month in March, the kidney care and diabetes communities are coming together to raise awareness about the connection between diabetes and chronic kidney disease, CKD. You know, folks, 1 in 7 adults in the U.S. currently has kidney disease, but many are unaware because symptoms are difficult to recognize in the early stages of the disease. Now, diabetes is one of the leading causes of kidney disease, and more than 122 million people in the U.S. are living with diabetes or prediabetes today. So, with all that in mind, my very special guests are Mandy Tilton, RN, Chief Nursing Officer at DaVita Kidney Care, and Dr. Robert A. Gabbay, MD, Chief Scientific and Medical Officer of American Diabetes Association. Welcome to you both.
Thank you for having us.
Well, guys, 1 in 7 adults in the U.S., it's rather a frightening statistic, isn't it?
That is a high number.
And, Doc, what do you, 1 in 7, that just seems so high.
Yeah, it really is. And, the piece that people sort of don't quite realize is, one, many of those people don't know they have it. And the good news is there's something we can do to prevent it from getting worse.
Well, give us an idea. What is the relationship between diabetes and kidney disease?
Well, if you look at all of the people with diabetes, 1/3 of them have kidney disease. And again, many don't know it. Kidney disease, diabetes is the leading cause of kidney disease. And the number 2 cause is high blood pressure. And many people with diabetes have high blood pressure. So really the two combine together to the people at high risk.
Yeah, diabetes and hypertension to impact kidney health. Diabetes it can damage the kidneys and cause them to fail. A lot of people don't realize that failing kidneys, you lose your ability to filter out waste products, and this is resulting in kidney disease. And 1 in 3 people with diabetes also have kidney disease. Who can be impacted by diabetes and kidney disease?
Well, everybody is at risk to some degree. For people at risk for diabetes, there is a wonderful and quick 1-minute risk test on the American Diabetes Association website that will help you figure out if you're at risk for diabetes. And, the risk for kidney disease, it's those individuals that have high blood pressure, high cholesterol, and whose blood sugars are not well controlled.
Mm-hmm. Mandy, early detection of CKD is possible through a screening that shows the level of kidney function. Now, for people who find out that they do have declining kidney function, it's important to connect with a kidney doctor, isn't it? Who can help slow down or even stop the progression of CKD before the total kidney failure.
That's right. Finding out that you have kidney disease early is very important. And as you mentioned, at that point in time, you really want to go to a kidney doctor called a nephrologist, so you can have a specialist help you identify ways that you as an individual can slow the progression of that disease.
Yeah, I read that there are ways people can manage their diabetes through diet, exercise. It sounds all cliche, medical support and emotional help. Similar healthy habits, people do, if they do all this stuff, you can actually manage kidney health. Is that correct, Doc?
That is correct. And all of those things that you mentioned are important in addition to avoiding smoking and seeing physicians regularly. So diabetes, kidney disease, these are all things that can be prevented and managed.
Yeah, it's how can someone listening, for instance, with diabetes prevent or slow the progression of the total kidney disease? What should they do right now?
Well, one thing is really, particularly with the pandemic where people haven't been engaging with their healthcare providers as they normally would, it's important to reach out and get screened. A simple blood test, the urine test can give a sense of where you are on the spectrum of kidney disease. And then have the right treatment. So along with what Mandy described as eating the right things, maintaining a healthy weight, and exercise, they're medicines that can really slow down the damage to the kidneys.
So what options do those newly diagnosed with kidney disease, what options do they have?
Well, early in the course of kidney disease is really where, honestly, we want to catch people, because you can essentially ensure that they're not going to develop, more dangerous kidney disease. And it's being on the right medicines, it's seeing your healthcare professional regularly, maintaining a healthy body weight, exercise, and definitely do not smoke, because that just makes it worse.
Yeah, it's a bad one. What about type 1 diabetes? Apparently, in my research, I found that it occurs at every age and in people of every race, shape, size, when the body just doesn't produce insulin. So type 2 diabetes is the most common form, apparently, of diabetes, and it means that your body doesn't use the insulin properly. So, for us laymen, does kidney failure occur when kidneys are no longer able to clean the toxins and waste product from the blood and perform their functions to full capacity? And I guess it happens over time. Is that right, Doctor?
Exactly right, Mark. Yes. The good news is that we know a lot about how to prevent reaching that last stage of kidney disease where people require dialysis or transplantation of the kidney.
Yeah, I lost my cousin over that many years ago, and I didn't really understand it all, but I've got a much better understanding of it now. From a nurse's point of view, you've served dialysis patients with DaVita for some 19 years, Mandy. What's the most prolific thing you take away from seeing all those cases?
Well, I would say the number one thing that I've taken away is so many of the individuals that I've cared for over the years did not know that they had kidney disease until it was very advanced, and in some cases until they had ultimately kidney failure. So early detection is so important. Even when you feel okay, it is so important to visit your physician routinely and have blood work done, because a lot of these things, such as kidney disease and diabetes, don't have symptoms right away until they're pretty far advanced. And so catch these things early.
Yeah, and Dr. Gabbay, you lead the ADA's effort to drive discovery within the world of diabetes research, care, and prevention. Is there any good news on the horizon you can share with us today?
Yes, there is. One of the things is over the last, couple, 3 years, we've identified a group of medications that not only do they help control blood sugars, and that's what they're primarily used for, but they also protect the kidneys in a way that is new and different. And that really holds promise to prevent people getting more advanced kidney disease. That's what it's all about.
And what, for those listening now that just may be concerned, maybe they think, well, gee, maybe that's what's wrong with me. Well, what's a personal test that you know or that you can do without panicking to give you a bit of an idea that you're heading down that track?
A simple blood test that you can have done in the laboratory will tell you exactly what your kidney function is. And that's a great place to start. Okay,
that's it. A simple blood test, and a lot can be done. Well, National Kidney Month, it's March, of course, and you do great work, you guys. DaVita and the American Diabetes Association, they partner to raise awareness on kidney health and diabetes during this month. And indeed, we were lucky to have Mandy Tilton, Chief Nursing Officer at DaVita Kidney Care, and Dr. Robert A. Gabbay, MD, Chief Scientific and Medical Officer of the American Diabetes Association. And thanks for all the good work you do, guys, and good luck with your future successes.
Thank you so much.
Thank you so much, Mark.
All right. Goodbye now.